Next, the highly infectious disease Mpox has been declared a public health emergency of international concern by the World Health Organization. The disease, formerly known as monkeypox, has spread rapidly across Central and East.
Miana Massey is on your corner with a warning from doctors that the virus might ultimately spill across international borders.
More than a dozen African nations have seen confirmed cases of Mpox this year.
The World Health Organization has declared the increasing spread of Mpox, also known as monkeypox, as a global health emergency. Doctors warn that the virus may eventually spread across international borders. Over 20 African nations have seen cases of Mpox this year, leading officials to declare a worldwide health emergency. The disease has spread rapidly across Central and East Africa since the start of the year, with 15,600 cases registered and over 500 deaths. The new strain of Mpox may be the most deadly, as it starts with flu-like symptoms and ends with severe symptoms. What are the symptoms of Mpox, and what does it look like? Mpox symptoms may start 3 to 17 days after you're exposed. The time between when you're exposed and when you have symptoms is called the incubation period. Mpox symptoms last 2 to 4 weeks and may include fever, skin rash, swollen lymph nodes, headache, muscle aches and back aches, chills, tiredness. About 1 to 4 days after you begin having a fever, a skin rash starts. The Mpox rash often first appears on the face, hands, or feet, and then spreads to other parts of the body. But in cases linked to the outbreak that started in 2022, the rash often started in the genital area, mouth, or throat. The Mpox rash goes through many stages. Flat spots turn into blisters. Then the blisters fill with pus, scab over, and fall off over a period of 2 to 4 weeks. You can spread Mpox while you have symptoms. So from when your symptoms start until your rash and scabs heal. See your healthcare professional right away if you have a new rash or any Mpox symptoms, even if you don't know anyone with Mpox. Dr. Amos, an infectious disease physician at Johns Hopkins, states that the Democratic Republic of Congo is experiencing the largest outbreak by far. In 2022, the disease triggered outbreaks in more than 70 countries, causing symptoms like fever, chills, body aches, and lesions. Doctors recommend vaccination as the best way to prevent illness. During the previous outbreak of Mpox in the United States, only 20% of the at-risk population was vaccinated, so many people still need to get vaccinated. The risk to the general public is considered very low, and officials expect sporadic cases to continue. The virus is common in the Democratic Republic of Congo, but it is spreading through physical contact or airborne transmission. Most patients are children, and there are 130 suspected cases, half of them under 5. The most common way to get infected is direct contact with a sick person. A public emergency of international concern is the highest level of alarm under the international health law. Vaccines against Mpox are possible, but they are not widely available in the DRC, where children have to rely on their immune systems. If more is not done to stop the spread of this new variant, the consequences will spread far beyond these camps. Take these steps to prevent infection with or the spread of the Mpox virus. Avoid close contact with people who have a rash that looks like Mpox. Avoid handling clothes, sheets, blankets, or other materials that have been in contact with an infected animal or person. Isolate people who have Mpox from healthy people. Wash your hands well with soap and water after any contact with an infected person or animal. If soap and water aren't available, use an alcohol-based hand sanitizer. Avoid animals that may carry the virus. What is the treatment for Mpox? Treatment for most people with Mpox is aimed at relieving symptoms. Care may include managing skin damage from the Mpox rash, drinking enough liquids to help keep stool soft, and pain management. If you have Mpox, isolate at home in a separate room from family and pets until your rash and scabs heal. There is no specific treatment approved for Mpox. Healthcare professionals may treat Mpox with some antiviral drugs used to treat smallpox, such as tecovirimat, TPOXX, or brincidofovir, Tembexa. For those unlikely to respond to the vaccine, a healthcare professional may offer Vaccinia immune globulin. This has antibodies from people who have been given the smallpox vaccine. Subscribe for more latest information. Thanks for watching.